Here, Misty, for all your Medicare needs.
If you are watching us this morning and you are dealing with low back pain, first of all, we are so sorry. And second of all, you don't have to deal with the pain. Dr. Jeff Hall is here. He is with Chattanooga Non-Surgical Orthopedics over off of Shallowford Road. Good to see you.
Good to be back. Thanks for having me back.
I'm glad you said good to be back. It's been a long time
it has been a while.
Talk to you. I remember things about you, Jeff, so well. So let me start with a couple of things to entice people in case Jeff is new to you. He would wow us when he would come on the show and talk about the non-surgical ways that he can relieve pain. He did it with me once on the air. I didn't even know I had the pain until he began to have me raise my arm up, and it was gone like that. It's never come back.
Yeah, the shoulder.
The shoulder,
I do remember that. Yeah,
you didn't know what was going to happen either.
No, we were just doing a demonstration.
But I know, I know that you love what you do because you see these life changes happen daily.
Yes.
With people who thought they were either stuck with the pain or having to face surgery. Sometimes they do, but you try everything you can to make that not happen.
I do. We take a non-invasive route first, non-surgical. Then if all systems fail, if it just doesn't work, then I'll refer them out for surgery.
So with the low back pain, that's a real problem, but do people sometimes think that it is low back pain, then you get in there and you find out it's really originating from some other part of the body?
Well, if it's low back pain, it usually is structural problems in the low back.
Okay.
And I usually have about a 95% success rate of avoiding surgery with the methods I use. So I really try to avoid surgery in the low back world.
So what are the methods?
So we use non-surgical spinal decompression, and then I've coupled it with PRP to rehydrate the disc and create a healing factor in there. So
what you like to do is to do both. You don't like a standalone.
No, I like to couple them, use them together, because I find that really works better.
So, I mean, I'm sure, like we said, if somebody's watching and they've got this pain, they're thinking, yeah, but I don't want to have to wait to get the relief. So if they come in and they begin this, typically how long before you feel it?
It can be anywhere from that day to a couple weeks.
So quick.
Yeah, usually patients are getting a lot of relief within a couple weeks. Obviously, the younger the patient is and the less degeneration they have, the quicker they get better.
Yeah. I've watched you in action before.
Yes.
I mean, years ago, we would come out and talk with him sometimes at the office there. And Jeff is here, he's very relaxed and nicely talking with me. When you're in your zone, you are laser focused.
Yes.
Do you feel it?
Yes. I really take my craft serious, and it's kind of my life. So
you're a little bit of a savant or something, but it's like you have a sixth sense about it.
I've been told that a lot, just even by patients. I guess it's my God-given gift.
So, okay, I'm gonna uncross my legs a minute because I'm realizing that my lower back is hurting a little bit.
Right now?
Yeah, because I was sitting lopsided. Is it one of the more chronic issues that your patients are dealing with?
Yes, 85% of patients have low back pain at some point of their life. So not everybody goes to the doctor, but the ones that do, usually we try to find the cause of low back pain because research says 90% is non-specific. What that means is they don't know what it is.
Not an injury or something.
Yeah, because MRI really only shows herniated disc, spinal stenosis, stuff like that. But that doesn't account for everybody's low back pain. So my goal is always to find the exact reason why they have low back pain and then eliminate the reason why they have low back pain.
You want the root cause.
Root cause.
So let's talk about if somebody's watching and they maybe have had an MRI done or imaging done, but they're going to call you. Would you want to take a look at the image they've had done, or do you like to see it for your own?
Yes, I do. I love MRIs. We use them ourselves.
Order them?
Yes,
okay.
Yes. Because it just gives you a blueprint of the spine.
Okay.
It doesn't always mean that's what's causing the low back pain, which is very clear when a patient has surgery sometimes and they come out either worse or no better, then that probably wasn't the cause of the low back pain.
I only have a couple of minutes left. On the decompression, you're wanting to combine it with that PRP. Why? Because the decompression is necessary because why?
So I kind of brought a model to show
okay.
you. So say someone has like a bulging disc. What we would do is decompress the disc back in, so the action of decompression will pull that disc back in, and then we use the PRP, paraspinal injection, to suck that into that disc, and PRP has growth factors in it that heal up connective tissue.
Mm-hmm. Are you using your own?
Yes, the patient, it's their own blood, obviously.
So when you do that, you kind of spin it, isn't that right?
Yeah, spin it.
Is it something that's only good for one usage, or can you use it a few times?
It's one usage. And
okay.
Then we take the platelets, that's the healing factors, and we pitch the plasma.
Okay.
That's the platelet poor plasma. We pitch it and keep the platelet rich plasma.
We're talking to you as people are about to travel. I've got about a minute left. If you can't get in to see him before you hit the road for the holiday season and you've got that back pain, just be mindful of how you sit in the car. Do you like lumbar pillows like we've got here?
Yes, those are all great. Obviously posture is very important with any pain in your body that's structural, like neck pain, back pain. So yes, these pillows work good for a lot of people because we sit too much as a culture anyway, and that's why we usually have low back pain.
I had forgotten how long you and I could talk given the opportunity. I hope you'll come back.
Yes.
If you are dealing with low back pain, he can help you. If you've got neck pain, shoulder pain, any pain, he really does have this sixth sense. 499-0003 is the phone number. cnsorthopedics.com. Find him there on Shallowford Road. Great to see you.
Thank you, Julie.
Did you know Hal loves to DIY? He's tried pottery, woodworking, he's even tried fixing his own car. Hey, maybe you could take your car to Budget Breaks.
Visit budgetbreaks.com for locations, coupons, and special bonus offers.
Now you can get Zaxby's Asian Sensation flavor on a salad, their famous chicken fingers,